Hello, welcome back to the Leukopak Lady. I'm so glad you've joined me. We're entering the 5th section of Season 3, and so far in this season I've talked about what good starting material looks like in 2026 and how that differs from what developers were using in 2018. I've talked about how to improve donor selection and connect it directly to manufacturing and clinical success. I've talked about how building master donor banks and long-term donor strategy ensures therapies reach the commercialization stage. And most recently, I've talked about why employing engineering principles to donor selection and starting material collection is the real solution to combating variability in manufacturing and clinical outcomes. This week, I focus on the importance of infrastructure to the success and commercialization of cell therapies, because even the best engineered system needs a strong infrastructure supporting it. Today, I ask a simple question. Are collection centers actually built to support commercial cell therapies? There are many centers out there collecting leukopaks for allogeneic therapy use. 35 independent centers in the U.S. alone by my count, not counting hospital-based collections. Most of these centers were designed for blood banking, plasma, and therapeutic collections, not for supporting allogeneic cell therapy manufacturing at scale and commercialization. Therefore, these centers have optimized for volume, throughput, and basic donor eligibility, which represents the needs of therapies in the R&D stage only. However, successful manufacturing processes, robust clinical responses, and commercializable therapies require something very different. Pre-collection testing, donor stratification, long-term donor management, standardized collection practices, and program-specific donor recruitment and collection. A gap is exposed and it has real commercial implications. If starting material is inconsistent, manufacturing outcomes become unpredictable. If manufacturing is unpredictable, two things can happen. Clinical outcomes can vary and the cost of goods increases. Variable clinical outcomes lead regulators to doubt the commercial feasibility of a therapy, and the high cost of goods means therapies will struggle to scale commercially. So the lack of attention to the details of donor qualification and standardized collections affects therapies' time to market, cost structure, ability to scale, and ultimately patient access. In 2026, collection centers no longer are just vendors. They are a critical part of the long-term commercial strategy of allogeneic cell and gene therapies. They're an essential part of the manufacturing process, regulatory approach, and clinical success. If centers don't evolve to support this system, they will become a bottleneck to commercialization and thus a risk to the overall commercial success of therapies. So join me on the next episode where I talk in more detail about the evolution of collection centers. Not all will evolve in the same way. A few centers will shift to meet the needs of the growing allogeneic cell therapy industry, but most centers risk continuing to be low-end providers of generic starting material. I'll see you then.